Hi, this presentation is targeted at clinics and health services administrators in the goal of showing how healthnotebook.com can help you to save a lot of time and efforts in managing your appointments and patients and clients. So you have a list here of things that we want to show you very fast in just a couple of minutes to really show you how you can modify and move appointments extremely easily and save time, allow different visualization of appointments through calendar and different view like we see here. We'll see more. Manage appointments for many practitioners, meds simultaneously. Possibly export your data in Excel. The way we can also for you import data if you already have a system and have a list of customers and appointments. It greatly facilitates also the process of confirming appointments. So we'll see just very fast some function, and after that we'll go and see how the clients we can communicate with by email of all the process from creating an account and making an appointment and confirming. Okay, so let's do a quick look at all the functionalities. So we said that we could move very easily appointments like that. It's as simple as drag and drop. Okay, you see also that when we position on it, we have more information about the content of the if you entered the content of the description of the appointments. Same thing here. So if you double click on it, you can edit the appointments and save it, and if you do save and send, it will send an email to the customers if there is an email associated with it. So if you put description here, it's in the body of the email, and this is the subject here that would go into the email. So if you just do, let's say for example, test here, blah blah blah, and I do save, so you see everything's went back here, and if we do a refresh, we would see in the description, you see test. I cannot position my cursor there because I would lose it. So you see at the end of the description for test something. So you see that it has been updated. You can also directly from the calendar itself, you could add directly an appointment, and you see that already there is some information inputted for you in it. So we'll just revise how we can create appointment. There's many ways we can do it like that through the calendar. You see here that the view is the day view, and in the day view you have a very nice flexibility of managing multiple practitioners or meds simultaneously. You can even drag and drop, for example, one appointments from that would be taken from one practitioner to another one. Let's see here. It's not very often, but it's very convenient if you have to do it, and after that you could take the same one and move it, the dates around from the month view or week view or whatever. You see here when it's just schedules, the schedule status, it's in orange like that, and expired also. But if it's a confirmed one, has been confirmed, it's in green. So you could easily manage it just by color like that. If you go in the list view, as I said, we could have multiple visualizations. So here you have the list view, and you can also extract just by status like that. For example, just the schedule, the expired, so just past appointments here. If you see the confirmed, I just have one. You see the green box I had here. So you see that this one, for example, was not. Okay, it was not confirmed. So another good functions here is that, let's say this client here, I just found him and I want to confirm the appointment. So I just have to click that and it's confirmed. Okay, if I continue, for example, on the possibility, for example, of, let's see, I click on export Excel here, I click on all, so the action I've just done would go, each action I'm doing would go in a Excel report. If I double click here, I see all the data with the emails here, phone number, address, etc. So it's very convenient. So if we go in the managing view here, by the way, because I'm in the fictive clinics here, I just have a few patients only, and I have automatically two tabs here that have been added, to administer patients, clients, and appointments. But you can have also standard users that would use our website just to search in the thousands, of health services and manage their own calendars through the site. Okay, so in your case, you're an admin, so you have access to this tab here. So let's see here, for example, Thomas Benetti, we could see the details, edit, add appointments directly from there. So you see there's many ways we can add appointments through this here, to the add appointment general one, and from the calendar as I showed you. So here, if we see the details of the information, we could edit it. At each step we can go back to list, so it's a good navigation. So starting from there, we'll just now for a couple of minutes walk through a real live example, just compressed in time. It could be something, you see, that you take an appointment 2 months ago, and few days near from the expiration of the appointment, you want to contact the client to confirm. So you would see how easily it's done. But first, let's add a patient here, a client. So let's say I add an existing customer, because I said that someone could already exist in the system. If it doesn't exist, it will create the account automatically through, if you enter a new email. Okay, but let's say I enter, this is my name, that's why I'm already there. But let's say here that you see, as soon as I position myself on another box, or I would like to create, I would not be able to do it because I have an error. But it's not really a real error. It's because this person, this email already exists. It's very well explained here. If you're sure of the email, you can merge your information that you will enter with the existing account and add it to your list of clients. So in fact, you associate it with your service, your clinics. Okay, but you must add the pound characters at the end of the email. So let's go and do it. So as soon as I do it, the error message is gone away. John Poulin, French name, sorry. By the way, it's all translated, and by the way, you could choose a language here and it would be all in French. So here I would create the individual, which in fact is not really a creation. In this case, it was an association with his account. So you see now it's in my list. Okay, from there I can add an appointment. So you see, I could have it created through the other link. At this time I would have all the list of all my customers, my clients, sorry, patients. But now, because I started from the file of this client, it's only himself that is there. The subject is the subject of the email at the same time. So checkup, etc. The description would be put in the email body. Of course, if the person doesn't have an email, we ask to enter the phone number followed by these initials. Okay, like in this case it would be phone number 123, etc. GP for John Poulin. So the description, in this case, there will be an email sent, so I can communicate with him. This is for checkup. Do not forget to be fasting for, let's say, 12 hours. So here you have the possibility to select if the customer, the client, has children, for example. If it's not already in his list and he has another children, let's say Peter, I just had it, and on the fly it's already available in the drop down list. Let's say the appointment is just for himself. So services is of course the fictive clinic that you are managing. The practitioner meds is you can select it here. If, let's say, I would like to add another one, it would be like the children. I would add it here and it would be added automatically here. So let's select here. Start, let's say October 29, 1540, 29, 50. By the way, you can put any time you want. You could, let's say 52 or whatever, 55, manually like that, or select it through the calendar as I showed you. So, and you saw in the calendar, by the way, that it's in cells of 10 minutes, but it's all configurable for you. So if you work by 15 minutes or 30 minutes, of course the calendar will be much more compressed and it could be more convenient for you. It's as you like. So this is a possibility by email when it will be in the personal calendar of your client. That you want him to have a little reminders automatically. This is the reminder of the personal system of your client, not yours. So because it's all, when you will receive an email, there will be, as you see, the little box here, it will be joined here an appointment calendar, ICS file, which is a standard file, that any system, personal system with Apple, Hotmail, Gmail, it's standard, so it can synchronize with any iPhone or any mobiles, okay, or any PC. Like for myself, I have Outlook, you see here, okay, so it would synchronize automatically. You'll see how it works in a minute. So there's a possibility of recurrence, so let's say I want, the practitioner to see it in, once a week for, let's say, 3 weeks. Okay. So if I do save, it would stay just in my system, the clinic system that you administer. If you do save and send, it would be, of course, saved, but also an email would be sent with all this, the contact card and the calendar card. So let's go ahead. Okay, and you see now that I have a new appointment. Okay, if I do here, I see the confirm. I have all here. Confirm one, I have the two that I confirm. You see this one, I confirmed it, and there was already this one. So the schedule, I have just this one. Okay, so whatever view you have, you just take this one here, and you would just very easily, you can send an email. Of course, if the person doesn't have an email, it will automatically assume that you phoned them and you want to populate, the status field with the status equals to confirm. Okay, so but let's say now I do send confirmation, so the person should have received an email. So let's go to see if everything worked. Okay, I will just push, the send and receive, because it's done every 15 minutes. You don't want to wait all this time. So you see here, there is an email sent, which was the first time, you remember, I added this client to my clinic, which is the fictive clinic. So we just, warned the client that it has been added, and if you want, to check his profile, etc. Okay, so here this is the other maintenance, because it's a I've done multiple, tests. So it's the other guy that was linked with my email address. So, but in fact, this is here. Sorry about that. Control. Wait a second. Okay, this is in fact the appointment that we sent. So you remember in the checkbox that we had the contact card. So this is the contact card. Of course, if I do save and close, so it would save it, but there's nothing to prevent that. For example, because I did the demonstration multiple times to other people, etc., so it would save it maybe the 5th time. So, but let's go and do it anyway. So we are able to see here, if we see search by fictive, so we have fictive clinic, which is there 4 times, but usually you don't do that, you just do it once. So, and same thing, of course, which is the more useful, is really the calendar appointment. So if it clicks on it, so you see here, this is the location that you would have configured on your own profile for your clinics, the subject here, and this is the description that you had here. You see, because it was a recurrent one, we see that it recurs every 1 week for 3 times. Okay, it could have been also end by a special date. So that's it. If I do save and close this time, so I go there and I see the 29 here because I did another demonstration previously, so I had another checkup. Okay, you see I did the demo in French, so it was in French here. So now it's in English in this demonstration. If I open the series, I see that in my personal system it still has the recurrence and it's still the same one as I configured on the website. So there's really a link, and the last one was the last operation we did. So remember that everything we did something that we would do maybe something in 2 months. We did it in a few minutes, okay? So this is the confirmation that has been sent a few days before, and if the client receive it, it said this is a reminder to your appointments with Dr. XYZ on this date, and it also gave back this instead, just in case he forgot it or lose it. So, and we say that important, please confirm your appointment by clicking this link. So I confirm, and you see here it automatically went on the website and it set the field status to confirm. So on your side automatically it's linked. So if, let's see, we go back there and we go now in confirm, so now we have 3 records confirmed. This one was not confirmed before, if you remember. So that's quite about it. It's if you want to contact us, you can contact us at this email address here, because this is the French site, but it's linked to healthnotebook.com also. So there's 2 domain names, or this is the phone number also. There will be a link here. This is the points that we reviewed. There will be a link to this video. If you see here, this is the part that I will just, even if there's another video for standard users, I will just show it to you, because this part here you could use it yourself. Let's say you're a clinic or health service and you often refer to other services or other, let's say, meds or practitioners or whatever. So let's say there's one that you don't find it here, you don't have in your private list. So I want to add, let's say, one that Verdun, because we live in Verdun City and I want everything. So I clear, so I keep region Montreal. So if I do search, so you see I have all those. Let's say I add this one, add to my list. I could add this one also. No, this one was in my list, so I could have the choice to remove it. So it's the way it works. So now it has been added. This one has been added. So you see, if you want to see some, you could remove it or see more details. Add appointments. For example, details here. You see that there is 49 meds, practitioners, all the specialties, everything. So it came from the Ministry, of Health here. So, but if you don't find it in the list and you want to be in this list, you just have to add a new service location and we'll monitor and we'll contact you. So that's about it. You would go there and that's it here. So it's very convenient, and don't hesitate to contact us, and I hope we'll have the chance to talk together. Thanks.